This video is to show how to do the muscle tests and also the treatment points. So I'm not going to do both sides, I'm just going to do one side and then show you the treatment points. So we start out, this is the hamstring muscle. Don't let me push your foot down. Okay, if that's weak, put your leg down. You're rubbing here at one side of the muscle and a little bit below the knee for the other side. Those are the points that will strengthen that. Okay, piriformis, you're pushing the foot straight out to the side. When you get to that, you're going to get, let me test this side. Push in. You go to the opposite side and you flush, it's called a fascial flush, the muscle along from the sacrum down to the trochanter. You can also rub those points as well. Okay? Next muscle is Gluteus Maximus. Lift your knee up, hold it up, and don't let me push down. Good, perfect. The points for that are right here at here's the top of the pelvic bone. You go down just a little bit, work that spot there, and then right on the muscle attaches towards the outside, right near the gluteal crease, right there. Those points there. Okay. Next is Popliteus, which is the muscle at the back of the knee. We bend the knee, turn your foot in. Don't let me turn it out. Good. And when you have a problem there, you work on the muscles on each side of the back of the knee, and then you get right into the center of the back of the knee.
Oh, wow.
Okay. Okay, trapezius. Bring your arm out to the side. So, John, you can get closer if you need to. Okay. Thumb pointing upward, and you're pushing back. I'm pushing down towards the floor. That's the test. Let your arm relax. And then the points for that are the inside of the shoulder blade right here and the spine here. So you're just deeply rubbing this whole area from the spine out to the shoulder blade. Okay, and then teres major. You make your hand, your fist is there, your elbow is up, you're pushing down, good. And then right out here, kind of on this little area, it's not on the shoulder, arm, it's not on the back, it's that little dip between it. That's the point for the teres major. Okay? Go ahead and turn over, Sandra. You come sitting up with your legs out straight. Then next is the abdominals. The straight abdominals is in front, and then you turn the body, you push this way, and turn the body, and you push this way. Okay, lie down. And the reflexes to strengthen are right along the ligament. There's a ligament that goes from the hip bones down to the pubic bone, and you're right above that. So this is where the massage point is there. That usually will take care of it. You can also get to it attaches to the ribs, so you can rub along the edge of the ribs here as well. Okay? Psoas muscle. You bring your leg up, roll it out. Let's do the other side. And push up against my hand. Good. But the way you fix that, you bend the knee and come a little closer. The muscle, you get very close to the midline, a little over to the right in the lower part, and you're pushing through. The muscle is underneath all of the organs. You're moving the leg to keep it's relaxed, and you're pressing deep and stretching that muscle. Sometimes if that doesn't work, you then have to get all the way on the inside of the thigh right there. That's where it attaches. Okay? Those are the 2 points for psoas. Okay, quadriceps. The knee is like here, and you're pushing towards the foot. Good. Now, remember that ligament that I talked about, the abdominals are above it, a little bit below it, right on the leg, is the top reflex for the quad, right there. And then also you find the kneecap, and it's two fingers above and 2 fingers right below, and finding all of these tender points right around the kneecap for the quad. Okay, Sartorius. I'm going to do it on this leg. You bring the knee up, you roll it out, keep the foot in the middle, and you're pushing the knee in and trying to pull the leg down, not out. You're pulling the leg the foot down, like that, okay? The reflex there, the most important one is right below, see where the swell of the knee comes in? That's the spot right there, about the size of a quarter. And sometimes you can go up to the hip bone, that's the other point where it may need it for the Sartorius. Gluteus Medius, let's do this side. You bring the leg out and push outward, good. And the point for that is right, that you can feel the trochanter, the little leg bone there, and you feel the top of the pelvic bone there. It's right between those two fingers, so you're right in there at the side, okay? Tensor fascia lata, turn your toes in, push up and out at 45 degrees, don't let me push down, good. And the reflex for that is all along the iliotibial band. So you're rubbing all along this band here. Okay? Adductors. Now adductors is you're pulling the legs together. So don't let me pull your legs apart. Good, it's the other side. And the fix for that, remember, bring your knees up, is pull your knees together and don't let me pull them apart. Now if they're weak, they'll be weak at first. If you just keep doing it, make sure they're not overstraining. They don't want to strain the muscle, just resisting. And after about 10 pulls, usually, it gets super strong. Because it's every time they resist, they're adjusting something that's strengthening the muscle. Okay? Quadratus Lumborum, put your legs down. Hold on to the table like you have there. Bring your legs over to the side. And don't let me push into the middle. Perfect. And don't let me push into the middle. Good. Now, if those are weak, the reflex for those is find the 11th and 12th ribs. There's those little ribs that don't wrap all the way around. They're called floating ribs. They're usually kind of pokey and a little tender, but you just rub those on each side for the quadratus. Okay, peroneus. Peroneus is the ankle foot muscle. So point the toes, kind of semi-point. You halfway, roll your foot out, and don't let me roll the foot in. Good. And don't let me roll the foot in. Okay, if that's weak, one part of the reflex is the side of the legs, right here, along the side. You rub that, and then you also rub, you go right off the ball of the foot below the big toe, and right in there. That's the other point. That's the point that's really sore, and you can even have people rub that themselves. Okay. Now, neck flexors. So there's 3 tests for the neck flexors. Lift your head up, hold your head up, push up. Notice how I'm cradling the head while I'm pushing. Turn your head, and this is the muscle here that we're working on. You can see it really easy on her. Push up that way and push up that way. The points are right off the mastoid process behind the ear, right there. See how the muscle comes right up to that spot? You're moving that point, and then you're also going down to the sternum and the clavicle, and you're rubbing right there. So here and here for that, okay? Then there's the upper trapezius. Push your hand this way, good. And push your hand this way, good. Now that is, the attachment of that is the back of the base of the skull. So you're really getting, you know, right where the neck muscles go into the skull. And then you're also getting the attachment, once you come from this angle, right in here, where the trapezius attaches. Good. Supraspinatus. Okay, the supraspinatus is like you're bringing the arm out and up about a foot, and then you're pushing in diagonally towards the hip, down and in, and the treatment point is this little depression between the arm and the chest. You just dig in there, and that's the spot that will generally help that muscle, supraspinatus. And now anterior deltoid. So we just did supraspinatus here. Then you move the arm in, and you're pushing straight down. Good. And this is right here. The point for that is right along the front of the shoulder, right there. Okay? Latissimus. Latissimus, hold your arm tight against your side. Don't let me pull out. Very good. Now this one, the latissimus muscle makes up, come from here, the back part of the fold of the armpit. So you follow it in, and the point is right there on the, it's on the arm where that muscle comes in, right there, okay? Then the next one is the pectoralis major clavicular. So this goes from the arm straight across to the clavicle. Turn your hand facing out. Don't let me push your arm out. And also the next one is the sternal. That attaches to the stern. Now pull towards your opposite hip. Okay. So the attachments for those are along the clavicle here for the first one, and along the sternum here for the second one, and they both attach into the arm in the front fold of the armpit. So they attach right about in here. So that's the spot where you would rub as well for both of those muscles. Okay? Serratus muscle. Bring your arms straight, hold it right there. Don't let me push down. Perfect. Now this is the one where all of these, it's like a serrated knife. There's a little segment of the muscle that attaches to each rib. So what you're doing is you're getting right in and you're working up on these are very, very tender. Be careful when you're rubbing them. But there's about 3 or 4 of them that'll be really hot, and then you can retest, and that'll be better. Deltoid. Okay, so the deltoid muscle is, if they're really pretty strong, you can use a long lever on the arm. You're going to push towards the feet. You say, don't let me push towards your feet. If they're a little frail and you don't want to use such a long lever, you can do the same test this way. Don't let me push towards your feet. And the treatment is, she has the wrong type of shirt. You know, if you have a shirt like this, it's all along your shirt seam. So it's like from here to here. So you're really massaging, all along here, and then the whole deltoid goes to one point about right there. So the front, the back, the top, and then down into that one spot there for the deltoid. Now these are 2 muscles that we didn't go over in class. I'm just going to show them really quickly so you can see them, because they're not weak as often. One is subscapularis. I'm going to try to push your hand up. You push down. Okay, good. And that muscle is on the inside of the arm right there. And then the teres minor is you have your elbow tight, push your hand out. I'm going to try to push it in. Okay, and that is more towards the back. More like right in here. Okay? Supinator. Now we're going to move into the elbow and the wrist. So you have the person rest their elbow, and then you grab their hand, doing like you're doing like a power shake, like that. You're holding it that way. Now first they start with their hand facing their face, and you're going to say hold it there, and you're going to try to turn it away from their face, okay? And then if that one is weak, the muscle is on the back, a little bit below the elbow on the back of the arm, right there. Then you have them turn, hold my hand again, and don't let me turn towards your face. Okay, and if that one's weak, the weakness is right on the, especially right inside the elbow, right at this point there. And then over here too. So you're here on one and then outside on the other. And then thumb to your little finger, hold it tight, don't let me pull them apart. That's nice and strong. If that's weak, you want to massage the wrist points to help stimulate the bones to hold together. This is something that can help with a carpal tunnel. And then you also want to get in here where the actual muscle is and retest there. And the other test that that we do is to test the TMJ. You hold the arm up, you're testing the arm, and you just touch the jaw joint and test. And then the way you find that spot is you go from the bottom of the ears, you come forward and you can even have them bite your teeth together, and you'll feel the muscle swell beneath your fingers. And then now relax your jaw, and then you rub hard here. It's a little tender for them. And then you also go feel on their temple for a spot that feels a little tender and swollen, and then you just rub that point too. So each one about 10 or 15 seconds. And that completes all of the muscle tests and how to correct them.